What if I told you there's something you already possess that could reduce your blood pressure within minutes? No prescriptions required, no expensive supplements needed, just your own breathing. Today I'm going to teach you 3 precise methods, and we'll practice them together so you can experience the effects firsthand. I'm Dr. Robert Harrison, and throughout my 20 years in cardiology, I've witnessed countless patients successfully manage their blood pressure without adding more medications to their regimen. I've observed systolic readings decrease by 15 to 20 points in mere minutes, not over days or weeks, but minutes. The reason these methods are so effective is that your breathing pattern has a direct influence on your nervous system. When you breathe rapidly and shallowly, your body releases stress hormones that cause your blood vessels to narrow. Conversely, when you breathe slowly and deeply, you trigger your body's relaxation response, causing blood vessels to widen and blood pressure to fall almost immediately. The pharmaceutical companies won't promote this information because there's no financial incentive in teaching people to control their breathing. However, the scientific evidence is compelling. Research published in a leading hypertension journal demonstrated that controlled, slow breathing lowered systolic pressure by an average of 15 points, results comparable to adding another prescription medication. The difference is that this approach costs nothing, produces no adverse effects, and puts you in complete control. By the time we finish today, you'll have practiced all 3 techniques alongside me. You'll understand exactly when to apply each method, and you'll have a reliable tool that works wherever you are whenever your pressure rises. Let's begin with the first technique. The first technique, 478 breathing. This method, developed by Dr. Andrew, while stands as one of the most effective relaxation techniques available. The pattern is straightforward. Inhale through your nose for a count of 4, hold that breath for 7 counts, then exhale through your mouth for 8 counts. The extended exhalation activates your parasympathetic nervous system, your body's rest and digest mode. This signals your blood vessels to relax and expand, which causes blood pressure to decrease. Let me share James's story. He's 72, and whenever he experienced stress, his blood pressure would surge to 165/95. Despite increasing medication dosages, the spikes continued. After I taught James this 478 breathing pattern, his pressure dropped to 140/85 within just 2 minutes of practice. That's a 25-point reduction. He began incorporating it 4 times throughout his day, and over time, his baseline pressure improved, allowing him to reduce his medication requirements, all from a simple breathing practice. Now let's do this together. Find a comfortable seated position with your spine straight but not rigid. Place one hand on your abdomen. You should feel it expand as you breathe in. If you have a blood pressure monitor available, take a reading now and write it down. We'll check again afterward. Are you ready? Begin by emptying your lungs completely through your mouth. Good. Now close your mouth and prepare to inhale through your nose for 4 seconds. Here we go. Breathe in. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4, 5, 6, 7. Now exhale slowly through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Excellent work. That's 1 complete cycle. Let's continue with 3 more rounds. Inhale through your nose. 1, 2, 3, 4. Hold it. 1, 2, 3, 4, 5, 6, 7. Exhale through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Again, breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. One final cycle. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale slowly. 1, 2, 3, 4, 5, 6, 7, 8. Perfect. Take a moment to notice how your body feels. Your heart rate has likely slowed and your shoulders may feel more relaxed. If you measured your pressure beforehand, check it again now. Many people observe a 5 to 10 point drop after just 4 cycles. Practice this pattern 4 times daily, in the morning, at midday, in the evening, and before bed. Each session takes only 2 minutes. This regular practice trains your nervous system to maintain a calmer baseline state. The second technique, resonant breathing. This method is even more straightforward. Simply breathe in for 5 seconds, then breathe out for 5 seconds. There's no breath holding, just smooth, continuous breathing at a rate of 6 breaths per minute. This particular rhythm is optimal for reducing blood pressure and bringing balance to your autonomic nervous system. Margaret's experience illustrates this perfectly. At 76, she suffered from white coat syndrome. Her blood pressure would spike to 170/100 from anxiety every time she visited the doctor. Even though her readings at home were normal, I taught her to practice resonant breathing in the waiting room for 5 minutes before her appointment. The result, her blood pressure at the doctor's office dropped to 35/82. Her physician was amazed. This works because breathing at 6 breaths per minute creates what's called cardiovascular resonance. Your heart rate variability becomes synchronized with your breathing pattern. Blood pressure decreases, heart rate stabilizes, and stress hormone levels decline. You can practice this technique anywhere, in your car, in a waiting room, or while watching television. Nobody around you will even know you're doing it. Let's practice together now. Place your hands on your abdomen. We'll breathe in for 5 counts, then out for 5 counts. Keep it smooth and steady. Don't force the breath. Just natural breathing at a slower pace. Ready? Breathe in. 1, 2, 3, 4, 5. Breathe out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. Breathe in through your nose. 1, 2, 3, 4, 5. Breathe out through your nose. 1, 2, 3, 4, 5. Continue. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. One more time. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. Excellent. Feel that sense of calm washing over you. Your blood pressure is decreasing right at this moment. For maximum benefit, practice this for 5 to 10 minutes twice each day, once in the morning and once in the evening. Use a phone timer or a breathing app to keep track. Consistency is crucial here. The more regularly you practice, the more naturally calm your nervous system will remain throughout the day. The third technique, alternate nostril breathing. This is the most powerful technique for emergency situations when your blood pressure suddenly spikes and you need immediate relief. Known as Nadi Shodhana in yoga traditions, this practice has been used for thousands of years. Modern scientific research confirms it can reduce blood pressure more rapidly than the previous 2 methods. Robert's story demonstrates this clearly. At 68, he experienced nighttime blood pressure spikes reaching 180/105. He would panic, which only made matters worse. After I taught him alternate nostril breathing, his pressure dropped to 150/90 within just 3 minutes. While still elevated, this brought him out of the danger zone and prevented numerous emergency room visits. Here's the technique. Use your right thumb to close your right nostril. Then breathe in through your left nostril for 4 counts. Next, use your right ring finger to close your left nostril while releasing your thumb. Then breathe out through your right nostril for 4 counts. Breathe in through the right nostril, close it, open the left, and breathe out through the left. That completes 1 full cycle. This practice balances your nervous system, immediately reduces stress hormones, and forces you into a slow, deep breathing pattern. Studies show this can produce a 10 to 15-point drop in blood pressure within 5 minutes. Let's practice together. Sit comfortably with your spine straight. Raise your right hand to your face. Your thumb will control your right nostril, and your ring finger will control your left nostril. You can rest your index and middle fingers on your forehead or fold them down, whichever feels more comfortable. Ready? Close your right nostril with your thumb and breathe in through your left nostril. 1, 2, 3, 4. Now close your left nostril with your ring finger and release your thumb. Breathe out through your right nostril. 1, 2, 3, 4. With your left nostril still closed, breathe in through your right. 1, 2, 3, 4. Close your right nostril with your thumb. Open your left and breathe out through your left nostril. 1, 2, 3, 4. That's 1 complete cycle. Let's do 3 more rounds. Close your right nostril and breathe in through your left. 1, 2, 3, 4. Close your left, open your right, and breathe out through your right. 1, 2, 3, 4. Breathe in through your right. 1, 2, 3, 4. Close your right, open your left, and breathe out through your left. 1, 2, 3, 4. Close your right nostril and breathe in through your left. 1, 2, 3, 4. Close your left, open your right, and breathe out through your right. 1, 2, 3, 4. Breathe in through your right. 1, 2, 3, 4. Close your right, open your left, and breathe out through your left. 1, 2, 3, 4. Perfect work. Notice the difference in how you feel now. Your blood pressure should be noticeably lower, and your heart rate should feel steady and calm. This is your emergency technique. Use it when stress hits, when panic sets in, or when you feel your pressure rising. 5 to 10 minutes of this practice can create dramatic positive changes. Your strategic protocol. Now let me explain how to use these three techniques strategically for maximum benefit. For technique 1, the 478 breathing, practice 4 times daily. Do it in the morning before getting out of bed, at mid-morning, in the late afternoon, and before sleep. Each session takes just 2 minutes for a total of 8 minutes throughout your day. This trains your nervous system to maintain a calmer baseline. For technique 2, resonant breathing, dedicate longer sessions of 5 to 10 minutes twice daily in the morning and evening. This becomes your maintenance practice, keeping your cardiovascular system balanced and reducing baseline stress over weeks and months. This will lower your average blood pressure significantly over time. For technique 3, alternate nostril breathing, reserve this for emergencies. When you experience blood pressure spikes, stress, anxiety, or a racing heart, this is your rescue technique. 5 minutes can bring you back to a calm state. Let me tell you about Susan, who combined all three approaches. At 73, her blood pressure was averaging 155/92, even on 2 medications. Her doctor wanted to add a third prescription. Susan requested 3 months to try these breathing techniques before adding more medication. She practiced 478 breathing 4 times daily, resonant breathing for 10 minutes every evening, and alternate nostril breathing whenever she felt stressed. 3 months later, her average blood pressure had dropped to 132/78. Still on the same 2 medications, that's a 23-point reduction in systolic pressure from breathing alone. Her doctor was shocked and agreed to hold off on the third medication. Susan has continued her daily practice and her blood pressure has remained controlled for 2 years now. These techniques work. The research is clear on this, but they require consistency. You can't practice them once and expect permanent results. Think of daily practice like taking medication daily, except there are no side effects, no costs, and no appointments required. Just 10 to 15 minutes daily dedicated to proper breathing. The mechanism behind this is simple yet powerful. Slow, deep breathing activates your parasympathetic nervous system, your rest and digest mode. This dilates your blood vessels, lowers your heart rate, and reduces cortisol and adrenaline levels, which directly lowers blood pressure. With consistent practice, this calmer state becomes your new baseline. Your nervous system essentially resets to a less reactive mode. Your action plan. Here's your step-by-step action plan to implement these techniques starting today. Step 1, check your blood pressure right now and write it down. This is your baseline for comparison. Step 2, choose which technique to start with. If you're new to breathing exercises, begin with technique 2, resonant breathing, because it's the simplest. If you need immediate relief right now, use technique 3, alternate nostril breathing. Step 3, practice for 5 minutes right now. Set a timer and focus completely on your breath. Step 4, check your blood pressure again after 5 minutes and compare it to your baseline. Most people see a 5 to 10 point drop immediately, which proves the technique is working. Step 5, commit to daily practice. Set phone reminders for morning and evening as a minimum. Make this non-negotiable, like brushing your teeth. Step 6, recheck your average blood pressure weekly and track your progress. Most people see noticeable improvements within 2 to 3 weeks of consistent practice. Step 7, share your results with your doctor. Show them your blood pressure log and the research supporting these techniques. Ask about the possibility of reducing medications as your blood pressure improves. Never stop taking medications without medical supervision, but these breathing practices often allow for reduction over time. Important safety notes. These techniques are safe for almost everyone. However, if you feel dizzy or lightheaded during practice, slow down and don't force it. If you have severe COPD or other serious lung disease, check with your doctor before beginning these practices. Remember, these techniques complement your medical treatment. They don't replace it. If you have very high blood pressure, you still need medications, but these practices can reduce how many you need. The bottom line, your breath is your most powerful blood pressure tool. It's free, always available, has no side effects, and it works. James dropped his pressure spikes by 25 points. Margaret conquered her white coat syndrome. Robert prevented multiple emergency room visits. Susan avoided needing a third medication. All of these results came from breathing techniques that take only minutes to learn and practice. Don't let anyone tell you that breathing exercises don't work. Hundreds of scientific studies prove their effectiveness. Most doctors don't mention them simply because they're not trained in breathing techniques during medical school. Medical education focuses on medications and procedures, not breathing practices. But you can control this yourself starting right now. If this video gave you practical tools you can use immediately, please share it with everyone you know who has high blood pressure. Subscribe to this channel because my mission is to provide actionable techniques that improve your health without requiring more medications. Thank you for watching and thank you for practicing with me today. I'll see you in the next video where we'll continue exploring practical tools for taking control of your